Guys, these are examples of rolling scars, these valleys that you see. So that's from intense inflammation from acne that causes collagen breakdown. Today we're doing a subcision procedure, which is the gold standard for treatment of rolling acne scars, the scars I just showed you. The first step is to use tumescent fluid, which is our numbing fluid. It numbs the area, but also separates the tissue in different planes. It lifts up the skin. So then it allows me to insert a probe to break up the fibrous bands that are tethering the overlying skin to the subcutaneous tissue, which causes the puckering and the hill and valley effect. As you can see, I'm using this special probe or cannula, which has got little sharp teeth in it. The patient's comfortable, not feeling it. We're breaking through the bands. And then I can also use a special needle called a no-core needle, and that still further aids me in separating tissue to break up the fibrous bands that are holding the skin down in a puckered manner. So I do this in a very methodical manner in both sides of the face. With this procedure, patients can have some downtime, some swelling and bruising for about a week. Most patients can use subcision 1 to 3 times to achieve their ideal goals. This is a great technique for rolling scars. Home run.